What does an academic cardiologist say about red meat, heart disease, and death from heart disease? I'm Dr. Eric Westman. Let's find out. This is a video that was sent to me from Midlife Crisis. Midlife Crisis is actually the channel of a Dr. Rohin Francis. He's a British cardiologist, a writer, comedian, and creator of the YouTube channel Midlife Crisis. He's working on his PhD and he is a cardiologist. And I can tell, and you can tell in listening to him, that he does have an academic background. So let's see what he says.
Here we go again, reeling from some more groundbreaking, shocking, and controversial dietary research. Or are we? This week saw the publication of 5 separate items of research concerning the consumption of red and processed meat. Are they helpful or just further confusing people who are already bombarded with contradictory messages? This video is going to be quick and dirty, rather like I have my burgers. But should those burgers be meat or veg? Unfortunately, there's a lot of tribalism that infects dietary discussions. So if you're a hardcore vegan or a carnivore supremacist, this video probably isn't going to be for you. However, if you are someone who's genuinely interested in the science and wants a neutral view, hopefully I can offer a bit of help. I have no conflicts of interest. I'm not selling a book or a diet plan. I'm not on the payroll of Big Moo or the Carrot Conspiracy. I am not a member of any food-related group or tribe, except maybe the Order of Honourable Taramasalata Fanatics.
Well, so he certainly is a comedian as well as a cardiologist. And let's see what the research says. He's talking about several articles published in the Annals of Internal Medicine, which is a very reputable internal medicine journal.
I mention all this because it's just intriguing to me how different groups cover the exact same research in different ways. The carnivores say it supports them, the vegans say that the research is wrong. So let's take a look. We'll start with a summary of what the research showed. This was actually 5 simultaneous publications. The first 3 were meta-analyses of observational studies with a minimum size of 1,000 people, and all of them put together, which is over 100 I think, looks at 6 million people. So this cannot be accused of being small. But these are observational studies, remember. And they looked at the big 3: death, cardiometabolic disorders, which includes heart disease and diabetes, and cancer. The next paper was a meta-analysis of randomized controlled trials, which are much higher in the ladder of reliability and quality of evidence. And they looked at 12 randomized controlled trials with a total of 54,000 people, but this was really dominated by one study, which was 49,000 strong. There was also a set of guidelines published, which we'll talk about a little bit later, and one of the publications was looking at attitudes really to do with meat eating, which was very interesting, but not really related to health outcomes, so I won't talk about that in this video. The observational meta-analyses actually showed nothing new. They revealed that over this large group of people, reduction in red meat consumption and processed meat resulted in a very small benefit in terms of the big 3 that I mentioned earlier. I've talked before about absolute versus relative risk reduction, so don't be fooled by studies that say your risk is halved, because if your risk is only 1% to begin with, then your actual real benefit is fairly negligible. For example, in real terms, what these studies show is that red meat reduction was associated with 4 fewer deaths from heart disease out of 1,000 people over 11 years.
4 fewer deaths out of 1,000 for every 1,000 people over 11 years. He's spot on in terms of the absolute value versus relative risk value. You want to be very careful when someone's emphasizing it's a 50% reduction, but they don't tell you whether it's relative risk reduction or absolute risk reduction. And he's focusing on the observational studies, giving them a little bit of, hey, these are not hypothesis testing articles, they're hypothesis generating. He's not using that language yet, but you can see he's being very cautious about these observational studies, even though there are lots of people in them.
These small population-wide benefits mean very little to an individual looking to see if she or he should change their dietary habits. You might assume that if I've just said that reducing red meat consumption causes a very small benefit, that means that everybody who does it will derive a very small benefit, but that's not how this works. It's actually the same concept behind why statins are so unpopular. Both reducing red meat consumption and taking a statin for primary prevention mean that the vast majority of people who do those things will actually derive no benefit, but a very small number will derive a very large benefit. In this case, probably around 4 people out of 1,000 over 11 years.
And that is called the number needed to treat. It's the inverse of the absolute risk reduction. And I've gone over that before. You can actually go to different websites and find out the number needed to treat for you to see if a treatment, for example, of a statin drug would be useful for you and what kind of absolute and relative risk reductions you might see. Of course, these are predictions.
But observational trials in diet are notoriously unreliable, primarily because of endless confounders, a reliance on self-reporting, the fact that you can't attribute causality in an observational trial, and looking for rare events that occur over long periods of time, like high blood pressure leading to a heart attack, need huge numbers and a very long period of follow-up.
Wow, he put all of the caveats or the limitations of observational studies all in that one sentence. That's fantastic. And that's why you don't want to use an observational study, even if there are millions of people involved, because it can't prove causation.
One way to increase your signal-to-noise ratio in your favor is to only follow up patients who are already at high risk of developing these problems. And that's what the PREDIMED study did, which is a whole nother debate, a study that was published, retracted, and republished with modifications. I don't think it was actually part of this analysis anyway. But what that does is if you take an at-risk population, that means that your findings might not be transferable and attributable to the wider population, because the majority of people reading this dietary advice are healthy. And we've talked about selection bias already on this channel a few times, so if you ask me, observational studies in diet are pointless and we should just stop doing them.
Amen. This is an academic cardiologist, and I have to say, of all of the academics, the cardiologists have been a little bit spoiled because they've been able to look at randomized controlled trials of medications for decades. There have been randomized trials of these cholesterol-lowering medicines for a long time, so they are pretty quick to dismiss the observational studies because in their field they look at lots of randomized controlled trials.
So let's concentrate on the randomized controlled trials, or RCTs, although these are also very challenging in dietary research. The analysis of 12 RCTs, which as I said was dominated by one, showed that there was no relationship between the consumption of red and processed meat and adverse health outcomes. And this is certainly what the press has picked up on in a big way, because the authors themselves have weighted the findings from RCTs more heavily than that from the observational studies, which seems quite fair enough to me, but make up your own mind. However, I want to highlight one key thing. The authors themselves, and I'm going to quote directly, said that their conclusions were based on low to very low quality evidence. This is a key piece of information that I feel has been a bit lost in most of the news stories that I've read. The critics of the research are numerous and from very prestigious backgrounds. They include the American Heart Association, the former president of the American College of Cardiology, the American Cancer Society, Harvard Medical School, the Physicians Committee for Responsible Eating, and if you really have any sense, you'll pay much more attention to them than some clown on YouTube, but are their criticisms valid? Many of their critiques could be leveled at pretty much all dietary research. As we've already said, observational studies in diet are basically trash. So in terms of quality of research, this is about as good as it gets. So I don't feel that that criticism is justified. The fact that real experts in the field can look at the exact same data and draw contradictory conclusions may mean that they're biased. I don't think that's the case here. I think in this case it's a reflection of the fact that the signal is so weak that it's hard to draw any definite conclusions. A fairly convincing argument could be made for saying that there's sufficient doubt to mean that you should stick to the current dietary advice. And certainly at the moment, all the major health organizations recommend reducing red meat. However, one could also now make a counter-argument to that, which would be fairly compelling as well. And I think the medical profession makes life difficult for itself when it starts trying to suggest a numerical value by how much red meat you should reduce, or how many helpings of processed meat you should eat per week, what is too much, because these figures would essentially just be plucked from the air. They're not based on anything. One of them.
I think that it was an excellent review of very important papers that summarize the observational studies of red meat and heart disease and cancer, and also then the randomized controlled trials of red meat and these outcomes. The observational studies had a very small, what we call clinically insignificant findings, statistically significant, but not clinically relevant. The randomized trials showed no difference at all based on the red meat. And because we value the randomized trials greater in the evidence-based medicine view of the hierarchy of clinical evidence, I would go on the side of saying there is not sufficient evidence to say you should reduce your red meat in terms of your health. And this is an academic cardiologist who's also a comedian and a great communicator. Thank you very much, Dr. Again, looking up Dr. Roheen Francis, a British cardiologist, an excellent review of clinical trials in meta-analyses for the risk of red meat and heart disease, and there really is no risk in my mind. I hope that's helpful. If you like this, please like, subscribe so you don't miss out on further videos, and ring the notification bell so you don't miss out. Also, share it with a friend. This is a grassroots effort after all. If you don't have my top 10 tips on how to start keto in the right way, please look in the description below. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.